Okay, in this video we're going to talk about Chapter 2, which is all about homeostasis and adaptive responses to stressors. So, if you all remember going back to anatomy and physiology, we talked about homeostasis, which is a point where all of the sort of the signs and symptoms in your body are at an ideal set point. And set point is the point at which certain homeostatic variables should normally be. So for instance, our body's normal set point for temperature is around 98.6 degrees Fahrenheit. And our body's normal set point for blood pressure is a certain value. And we'll have normal set points for other values like the concentration of water in our blood, the amount of potassium in our blood, or the amount of a given hormone in our blood. All of those relate to set point, which is achieved or maintained by homeostasis. And really, we think of homeostasis as being a state of internal balance in our bodies, because our bodies are always sort of exposed to factors that could change our internal environment, but all of our organ systems can work together to maintain stability and keep values constant in our body. We refer to that as being homeostasis. Now, if set point is changed some way, like if your body temperature becomes too low away from set point, then we'll have an appropriate homeostatic response. And these homeostatic responses are these mechanistic and predictable series of orchestrated internal events. Really what this refers to is that your organ systems will function to achieve homeostasis, and they're always going to respond in a particular way to help you get to homeostasis. Unless there's a certain disease process occurring, homeostatic responses should be mechanistic in the sense that they are predictable, and they're going to be orchestrated in the sense that they'll work with other organ systems to help achieve homeostasis. Now, allostasis is the word we use to describe how our body can address the complexities and variable levels of activity that are necessary to reestablish or maintain homeostasis. So for instance, let's say if someone lost a lot of water due to pretty severe burns throughout their body, well, there's going to be a certain degree of allostasis which will help that individual compensate for that water loss to still maintain set point. And really what those compensatory mechanisms would be basically factors that act to conserve water and increase blood pressure. So allostasis are the mechanisms that are involved in helping us to return back to homeostasis. Now, if allostasis can't be achieved, that's when we get sort of a more acute or chronic disease process where there's other sequelae as a consequence of not being able to reestablish homeostasis. So when we talk about what clinicians do is ultimately they're kind of helping allostasis and they're helping to reestablish homeostasis in their patients' bodies. Now, we talk about these allostatic responses as being carried out by superordinate set of symptoms or systems that support homeostasis in light of changes in the environment, whether external or internal. And superordinate means that they're controlling level. So, for instance, most of these superordinate systems involve places like the hypothalamus in your brain or the brainstem, and these are going to help monitor and maintain homeostasis through a series of feedback loops, whether they're positive or negative feedback loops. Now, one thing that can take us away from homeostasis is this idea as stress. And stress isn't always emotional. It's more commonly used to describe emotional factors, but stresses can be physical and chemical on the body, but ultimately they lead to tension of the body or mind. And the stress, if it's severe enough, can actually lead to changes that can be damaging in our own bodies. So for instance, let's say if you were emotionally stressed and that caused you to lack sleep, well, the lack of sleep actually leads to measurable cellular changes where basically wastes start to build up inside of your cells, and that leads to stress on those cells, which can lead to stress in the tissue and organ and further complications or damage. There's something to be said about beauty sleep, and that's one way to help sort of reverse the effects of stress, at least emotionally. But there are physical and chemical factors of stress too. So physical type of stress could be some sort of physical trauma to an organ or tissue, or chemical stress could be changing some sort of value in your body. Like let's say if you had too much potassium, like hypernatremia, that could be a form of chemical stress on your body. Now, we talk about our ability to accommodate stress through this general adaptation syndrome, or GAS. So general adaptation syndrome is basically allostasis, and there are a series of events that try to help us achieve homeostasis. They try to bring us back to homeostasis. Now, what can happen in this general adaptation syndrome is that along the timeline of events that occur following an initial stressful event, there's things that occur like the alarm reaction or a stage of resistance. An alarm reaction is basically your sympathetic fight or flight response to that stressful stimulus. Okay. Now, what this will do is increase the level of certain hormones throughout your body to influence those organ systems to help maintain or achieve homeostasis in light of that stressful event. So when you think of the alarm reaction, this is kind of more of the acute response to stress. Now, the stage of resistance are the activities that your nervous system and your endocrine systems do to help return your body to homeostasis. And this resistance stage can be, sort of short-term or even long-term. But where you can run into trouble is if the stage of resistance is no longer effective. If you overload your stage of resistance and you can't achieve homeostasis, that's going to lead to other sequelae, which can lead to further damage and to certain disease processes. So we call this stage of exhaustion. So if you overload your ability to return to homeostasis, that can lead to this exhaustion stage. And exhaustion can occur both acute or chronic. Typically, it's going to be more of a chronic effective stress on the body, but it's the point where the body can no longer return to homeostasis. Now, we talk about this as also being called allostatic overload, which is sort of the cost to your body's internal organs due to the inability of you being able to return back to homeostasis and the cost of that damage on those organ systems. And we'll talk about allostatic overload on certain organ systems in future chapters and the effects on those organs as a result of that stress. Now, one thing that's important to note is that sort of initially during the alarm phase, there are the superordinate systems like your hypothalamus and brainstem that help mediate certain allostatic responses. So, for instance, the hypothalamus, it's involved with the emotional responses to stressors. So the hypothalamus plays a role in activating your sympathetic nervous system, and it does this by controlling the release of hormones by the pituitary gland, which can control the release of hormones from your adrenal glands, such as hormones from the adrenal medulla, as well as hormones from the adrenal cortex. Now, we talk about stress hormones, we talk about the catecholamines and the adrenocortical hormones like glucocorticoids. The types of hormones that come from your adrenal medulla are the catecholamines like epinephrine and norepinephrine, or basically adrenaline and noradrenaline. And the main sort of stress hormone from your adrenal cortex, which is the outer layer of your adrenal gland, are glucocorticoids, which include things like cortisol, which is basically corticosterone. But those are stress hormones that basically change your body in a way that's consistent with the stress response. Now, stressors are those agents or conditions that can produce stress. Now, stressors can ultimately endanger homeostasis in the body, and stressors, like I said earlier, can be physical, chemical, emotional, but they can also be biological, social, and cultural. So, for instance, there are some things like there's a culturally bound syndrome in the southern United States. It's called basically called passing out, where in response to so much stress, people will faint because of that stress. Now, you don't find that in other parts of the United States more commonly because it's a cultural phenomenon you find in the southern United States called passing out, and it's basically the physical response to stress on that person's body. But that's a cultural phenomenon. It's not really a biological phenomenon. It's basically a psychological understanding of maybe how you should behave in response to stress, and therefore it's cultural. But there are chemical and biological factors as well. Now, stressors can vary in scope, intensity, and duration, and psychologists can rank emotional stressors on a certain scale. Probably one of the most stressful events in someone's life are things like death in the family or moving. Uh, Circumstances which require a lot of change are usually very stressful, but stressors can vary in scope. Like a stressor could be maybe somebody driving extremely slow in the fast lane, and you're freaking out about how slow they're driving, and you might think, oh, that's a a severe stressor, and that can vary in scope, intensity, and duration from person to person. One person might get over the fact that someone's driving slowly more quickly than another, and so stressors can vary in scope, intensity, and duration. Now, risk factors are not the stressors themselves, but the conditions or situations that increase the likelihood of encountering a stressor. So there's lots of different risk factors for stressors, because stressors can be chemical, biological, emotional, social, or cultural. The risk factors for stress can be pretty wide, and we'll talk about those risk factors throughout this class. And it really just depends on what disease process we're discussing. But those risk factors can play a role in the development of stress. If you're playing with fire, that's a risk factor for being burned, which would be a form of physical stress on your tissue. Now, there are some hormonal responses to stress, like the catecholamines and your adrenocorticosteroids. The catecholamines include things like norepinephrine and epinephrine. Norepinephrine is also called noradrenaline. Epinephrine is called adrenaline. And these hormones are released by your adrenal medulla in response to stress. Now, they do play an integral role in allostasis because in response to stress, these hormones can change the activities of organ systems to promote homeostasis during the sympathetic response. Now, other hormones like the adrenocorticosteroids, like cortisol and aldosterone, are also important in mediating the stress response. And these can have effects that can increase or even decrease the effects of epinephrine and norepinephrine. It really just depends on the organ system. Now, some other hormones that are released during the stress response could be things like endorphins and enkephalins. What's interesting about these endorphins and enkephalins is that these are endogenous opioids, or basically your body's natural pain relievers. Now, as stress hormones, what these help us with is actually to raise our pain threshold and produce a sensation of like sedation or euphoria, which can at least help us get through the emotional aspects of stress. If someone is trying to run away from a lion, but they have a broken leg, it can be important to release these endorphins and enkephalins. That way someone isn't really focusing on the pain of their broken bone and more focusing on their own survival to not be eaten by that lion. Now, there are also sort of hormones that are released by your immune system during a stress response. And so what's really interesting is that stress and immunity kind of go hand in hand. Now, in the short term, stress can increase or enhance your immune response. However, chronic stress can have a deleterious or detrimental effect on your immune system, where chronic stress can actually lead to a depressed immune system. And I've found this in myself, where let's say if I'm taking a stressful class or something, I'm probably more likely to get sick that semester or quarter because of my immune system being depressed. But it might also relate to things like lack of sleep and poor diet and lack of exercise. There's lots of different factors that could be involved with that. But what's important to note though is that there are immune cytokines. So they're released by certain immune cells during the stress response that can enhance your immune system in the short term. However, in the long term, they can depress your immune system. Now, other hormones like estrogen, testosterone, and dehydroepiandrosterone, those can affect the stress response as well, and they also influence allostasis. So estrogen and testosterone can be released during the stress response. Other hormones like growth hormone are increased during the stress response because growth hormone actually prevents the effects of insulin. So growth hormone can help keep your sort of nutrient levels high in the bloodstream during the stress response, which can help your organs achieve allostasis. Now, prolactin is also released during the stress response, and this has an effect on your immune system. Oxytocin is also released during the stress response, and it's actually associated with things like social attachment and pair bonding. So what's interesting is that some of my closest friendships, at least just personally, this is totally anecdotal evidence, is that like there are friends that I took classes with, and we became really close because they were difficult classes, and I imagine we were all releasing a lot of oxytocin, which helped us with our social attachment and pair bonding. We became really close friends. But what's interesting though is that this hormone, oxytocin, is released during the stress response, and you're more likely to form friendships and close relationships during these stressful times. So it's kind of interesting. Now, when we talk about adaptation to stress, adaptation is this biopsychosocial process of change that occurs under new or altered circumstances. Now, these biopsychosocial processes can be internal or external in origin, but ultimately that our body's going to help to adapt to these changes in a variety of different ways that involve your organ systems. Now, coping is more of this behavioral adaptive response to stress, and people have lots of different coping mechanisms for stress. I know a lot of people who will exercise when they're stressed because that's their coping mechanism, and that's their behavioral adaptive response to stress because it makes them feel less stress. Now, we often use the words adaptation and coping interchangeably in pathophysiology, but usually adaptation can refer to psychological and non-psychological processes, whereas usually coping mechanisms just refer to psychological phenomena. Now, distress is someone's perceived inability to cope with a stressor. So if someone thinks that their stress is too severe, then that's what we define as distress. And typically distress is going to lead to some pretty dramatic effects. Because if someone perceives that they can't do anything to help with their stress, well, that may lead to allostatic overload, which is where there's inadequate mechanisms to respond to that stress, and the individual is going to have difficulty getting back to homeostasis. Now, pathophysiological stress really results from when all the organ systems fail to bring your body back to homeostasis, and this relies on emotional and biological factors. Now, what's interesting is that there's a lot of effects of stress on the organ systems of our body. So if we just work our way through each of the organ systems, well, we'll look at the nervous system, the cardiovascular system, the GI system, our genitourinary system, integument, respiratory, immune, endocrine, and musculoskeletal systems. Stress has an influence on or effect on all of these systems. Now, in terms of the nervous system, there can be a lot of psychological manifestations that can occur. Things like nervous tics can occur, or this idea of fatigue, like feeling tired, a loss of motivation, anxiety, overeating, undereating, depression, and insomnia. These are all more psychological manifestations of stress, and these are kind of well understood most people understand this. Now, cardiovascularly, what's interesting is that stress can actually have a disturbance on heart rate and rhythm. So stress can abnormally cause your heart rate to be faster, but stress can also cause abnormal rhythms to occur in your heart. Like you can have arrhythmias that can occur from too many catecholamines exciting your heart. And those arrhythmias can lead to a variety of problems. Now, if your heart rate is too fast, that can lead to hypertension or high blood pressure, which can also put you at risk for stroke and coronary artery disease. And these relate also to stress. So these aren't associated with short-term stress, though. Typically, short-term stress can relate to things like abnormal heart rate and rhythm. You might see a little bit of hypertension in the short term, but in the long term, that can make someone more susceptible for stroke as well as coronary artery disease. In fact, I was just reading an article recently that one of the risk factors for stroke in females is chronic depression. So for females who are chronically depressed, they're at a higher risk for stroke than people who are not depressed, because that is the physical manifestation on their body as a consequence of that stress. In terms of the gastrointestinal system, you can see things like inflammatory bowel disease and gastritis. This inflammation of the bowels can lead to things like diarrhea, nausea, vomiting, as well as ulcer formation that can lead to pain and infection. Now, on the genitourinary system, stress can lead to diuresis or too much water loss. It can lead to irritable bowel, sexual dysfunction, as well as menstrual irregularities can occur in response to stress. On the skin, we can see a lot of skin disorders occurring. Things like eczema, psoriasis, dermatitis, and acne are all associated with stress, and even including hair loss, because stress can influence the cardiovascular system. If someone's not getting enough blood flow to their hair follicles, their hair can start to fall out. So hair loss is also associated with stress, but more like chronic stress. In the respiratory system, we can see things like increased respiration, as well as inflammatory disturbances that can relate to things like asthma and hay fever. Asthma can result from too much inflammation in the airways of the lungs. Hay fever is basically sort of it relates to allergies that are seasonal, and that can lead to inflammation along the respiratory tract as well, which can be exacerbated by stress. Now, stress on the immune system can lead to decreased immune responses like immunodeficiency and immunosuppression. But what's interesting too is that stress may relate to autoimmune disease. So that if someone is stressed, that can actually exacerbate their autoimmune disease. And so it's interesting how stress has an influence on our immune system in that regard. Now, on the endocrine system, we can see things like hyperglycemia as well as diabetes. So high blood sugar, and that can lead to diabetes in the long term. That's the endocrine response of stress. And other musculoskeletal effects of stress can be things like tension headache, muscle contraction, backache. Again, that's like tension headache, but contraction of muscles in the back, which can make that back very painful. Rheumatoid arthritis can be exacerbated by too much muscle contraction, as well as inflammatory diseases of certain connective tissues. So the connective tissues associated with joints and other skeletal tissues can become more inflamed in response to stress, and that can lead to more long-term problems in the musculoskeletal system. So in terms of an exam or quiz format, I want you guys to know the effects of stress on each organ system and be able to tell me what those effects are.